Hello, my name is Ian Hutchinson and I'm a registered specialist in orthodontics and clinical director and business partner of Wired Orthodontic Laboratory. In addition to laboratory work, we also run a series of postgraduate training courses. Following on from these courses, we've developed an iPhone app to help you maximise the return from the laboratory, and also included a series of short videos to help you in your clinical practice. We hope you find them helpful.
I've been using a short-term orthodontic system with my patients for some time, and I was disappointed, not with the results I was getting, but with the quality of the product, constant bracket debonds, brackets wearing and so on. And so I looked around to see what other systems were available out there. I find Simply Smile incredibly easy to fit. There are fewer components with this system compared to the systems that I've been using before, and so there's little room for operator error. The carrier system is completely transparent, which allows you to see the fit of the bracket onto the surface of the tooth, and that, along with its single stage bonding system, means it's a very quick process. I can do a top and bottom arch complete bond up in about half an hour.
The whole process was a lot quicker than what I imagined. First of all, just how quick it's taken for my teeth to be straight. I thought it would take at least 6 months, but it's been 3 so far. When I go to get my wire changed, it's literally in and out.
The quality of the product is far and beyond anything that I've used before. The brackets are ceramic and allow you to do more complex cases because they're not prone to wear like another system that I've used. I found that the surface of the bracket is so highly polished that plaque retention from patients who perhaps weren't the best brushes in the world, compared to another system, it doesn't seem to hold the plaque. And so patients are coming back time after time and the brackets look brand new.
It was mainly because I saw it on my friend first. It's the first time I've heard of it. And it was just completely discreet. I wouldn't have known she had it. And being 28 and having a brace.
The Simply Smile accreditation course was a really good fun day. There was lots of hands-on, there was lots of practical. The teaching was really clear, and it wasn't overly technical. It was sort of down at the level of me. I'm just a GDP. I'm not a specialist orthodontist. With Simply Smile you have the online forum, which allows you to post cases and get advice from experienced users. It also has the advantage of a specialist orthodontist who you can ask advice for to help you through your cases. As a Simply Smile registered provider, at the end of the course you get access to an iBook. The iBook essentially is a condensed version of the day's seminar and will allow you to go back and refresh yourself with points which you may not have taken fully on board at the time. It gives you that sort of comfort to know you've got something to go back to refer to.
I definitely recommend it. My sisters already want to come and have a consultation to have their teeth done.
Well, I came to see my dentist and I spoke about the bottom of my teeth because I grind my teeth as I sleep, I've had quite a prominent tooth at the bottom of my teeth, and that tooth overnight gradually has been chipping away at my top teeth, which is obviously an issue. So I came to my dentist, spoke to him about maybe filing the tooth down or anything like that, which he obviously isn't willing to do because they're healthy teeth, and mentioned sort of the best way of fixing that would potentially be a brace, which I was a little bit nervous about at first, but when he explained everything, it seemed like that was the sort of best thing to do. So I came in to see my dentist. It was about a 30 to 45 minute consultation. He sort of run me through the process of how they make the brace, and which is massively detailed, I think. He also said how he went through how it would be fitted onto the bottom of my teeth. He took two or three moulds as well of the bottom and the top, so they could see how I bite, and then they would personally make that brace for me. And then he just spoke about how long it would take to be fitted and things like that as well. I was told the lingual brace would be the best results for me for the bottom teeth. It's really quick and fast, so that'll be done hopefully within 3, 4, 5 months, which is really quick, I think. But also it gives me the chance that if it's not off by the time I get married this year, in pictures and things, you won't even see it. It'll be completely invisible. So that gives me that opportunity as well, and there's no time pressures then. We can just get it done in the time that it needs. I'm hoping to get, I guess, the perfect smile, nice straight teeth on the bottom, sort of target the chipping and the grinding as I sleep. Hopefully that can prevent that as well. And hopefully feel more confident on my wedding day when I do laugh and smile, that I don't have sort of unsightly poking out teeth or anything like that. So hopefully that's the main aim.